Good evening and welcome to our second evening of Women's Week. Our speaker this evening is Dr. Rosa McMillan. Rosa is a foundation doctor who graduated from Glasgow University in 2020. After her third year of medicine, she undertook an intercalated Bachelor of Science degree in the Department of Medical Humanities, studying the history of medicine. She concentrated her research on the history of women in Glasgow Royal Infirmary Pathology Department, and it is this topic that she will be discussing tonight. Rosa won the St Mungo's Medal in 2018 at Glasgow Royal Infirmary and the Nora Schuster Prize in London. Her dissertation also won the Dame Claire Marks Prize for Women in Surgery. So Rosa is coming back to work at the Royal next year for her second year of foundation, and I'm really looking forward to working with her again.
Hello, I'm Rosa McMillan and I'm an FY1 currently at Monklands Hospital, but coming to the GRI next year. Thank you very much for asking me to speak today about the niche, but hopefully more interesting than it sounds, topic about women in pathology at the Glasgow Royal Infirmary, or the Glasgow Royal Infirmary had vision without which the people perish. This photograph shows Dr. Elsie Ingalls, the determined looking one in the middle of the second row. She, as I'm sure many of you know, founded the Scottish Women's Hospitals, which were hospitals staffed entirely by women during the First World War in continental Europe. Yet, although she officially graduated from Edinburgh, and they certainly claim all the credit for her now, she did most of her clinical instruction as a student in the Glasgow Royal Infirmary. This was after she and some colleagues had an argument over clinical instruction with Sophia Jex-Blake, the founder and head of the Edinburgh Medical School for Women. Ingalls doing her clinical instruction in GRI led to the legend of this photograph discussing early female clinical instruction, saying how the Glasgow Royal Infirmary had vision without which the people perish, a quote adapted from the biblical book of Proverbs. This slide shows how the GRI pathology department specifically did have vision, with 20 of the 38 doctors employed between 1910 and 1930 being female. This photograph from 1928 shows that there were more women than men. In the middle of the front row is Dr. Alice Marshall, whose book on the department was the main source used, with the other sources shown on screen here. This talk will address the reasons that this came about, and for this we have to go back to the end of the 19th century. This slide shows the development of clinical medical teaching in Glasgow. All Glasgow University clinical instruction moved from the GRI to the newly opened Western Infirmary in 1874. This led to the GRI managers saying the following of the situation. The managers regard the establishment of the proposed college as of the highest importance to the hospital by enabling them to obtain, in the persons of the professors, a continuance of the best medical skill for patients, and by ensuring at all times the attendance as dressers of the requisite number of students. Dressers were basically assistants in theatre. In an attempt to solve these issues, the managers formed the St Mungo's College in 1876. St Mungo's accepted some women, but the majority went to Queen Margaret College on its opening in 1890. Queen Margaret College for Women was later incorporated into Glasgow University. This slide shows details of the Muirhead Bequest, on which the proposal for a QMC medical school was established. Dr. Henry Muirhead was a psychiatrist who owned various Lanarkshire asylums, and on his death in 1890, he left money for the founding and maintaining an institution for the instruction of women in physical and biological sciences, but not theological. He did not wish it to be called Victoria or Queen's, little has either done for poorer sisters. However, ironically, his money eventually was associated with a college named Queen. However, it took till 1911 for a deal to be reached amongst the University of Glasgow, the GRI and the Muirhead trustees, partly because the £40,000 had to be matched by St Mungo's College. Yet eventually, in 1911, the four chairs seen on screen were formed. The Muirhead Chair of Obstetrics and Gynecology, the Muirhead Chair of Medicine, and the St Mungo's Chair of Surgery and St Mungo's Chair of Pathology. This slide shows the number of newly matriculating medical students each year that there's data available from 1914. The women are in red and the men are in blue. As you can see, there were always more males than females, although there's an increase in the number of women newly matriculating during the time of the First World War, when the men were away serving. However, on their return in 1919, there's a clear spike in the number of males newly matriculating, with the number of women dropping. Furthermore, as Glasgow became saturated with doctors, the total number of newly matriculating students fell, but this disproportionately affected the women, as shown in these pie charts, with the top being from 1917 and the bottom being from 1924. This notably also occurred in Edinburgh. This slide shows the result of the initial increase in the number of female medical students. In 1920, as you can see, 10 of the 19 residents, today's FY1s, were female. This was in part due to the job system at the time, where you got jobs in departments where you'd been a student. As the GRI was the only hospital taking female medical students, this led to Dr. Annie Laurie, who did her residency here, saying, "Oh well, they all had to be at the Royal." This slide shows that by 1928, this had fallen rapidly to 3 out of 15 residents being female. Dr. Annie Laurie also commented on this, as shown here. "All these men who come home, they got all the jobs. Why should they take a wee lassie like me when they could take a big officer?" Interestingly, this initial increase in the number of residents did not happen in Edinburgh, and the first female resident in the nearby Western Infirmary was in 1946, almost 50 years after the first female resident in the GRI in 1899. By this point, you might be thinking that this phenomenon was fairly clearly due to the First World War, with a higher number of female graduates before they dropped off again. However, this slide shows that the peak increase in women in the pathology department specifically was just after the war, meaning that the majority of females had to start their medical training before, or at the very least at the very start of the war. Furthermore, women were notably not employed in the pathology department in either the Edinburgh Royal or the Western Infirmary. So why was there this high number of females in the pathology department at the GRI? This slide shows a woman, Dr. Mary Baird Haney, who was employed in the pathology department before 1910, as she was one of only 2 women employed before this time. However, she missed on promotion, with a man elected before her, as she was barred from holding the fellowship of the Glasgow Faculty of Physicians and Surgeons of Glasgow, today's college. Because she was a woman, and according to the GRI minute books from the time, it is understood Miss Haney quite appreciated that this disability prevents her application being considered. This slide shows Professor John Hammond, teacher, head of department from 1909 to 1930. It was under him that the 20 women were employed, as before him becoming head of department, as mentioned, it was predominantly male. This slide primarily shows my favourite fun fact about Professor Teacher, who was part of the Teacher's whisky family, leading to his quote that whisky is a serviceable substitute should other fixatives be unavailable. Moving on, he graduated from Glasgow University before working in the Western Infirmary in the world-famous pathology department under Professor Sir Robert Muir of Muir's Textbook of Pathology. In 1909, he moved to be head of department at the GRI. This slide shows that Professor Teacher became the St Mungo's Professor of Pathology on its formation due to the Muirhead bequest in 1911. In his speech on acceptance of the chair, he said the following: "I prefer the man or woman who can take his or her share of the daily work of the laboratory or wards and find research in his routine work or prove his capacity by developing research on other lines at the same time." This quote has a couple of important points to highlight. Firstly, this slide highlights his receptiveness to women. Even now, many people would just refer to man, yet he specifically mentions women too. unusual for 1911, as women couldn't even vote at this point, never mind when referring to female doctors. His receptiveness towards women was furthered when he proposed women to Glasgow Medchair in 1911. The doctor who said he'd proposed them did not appear and sent no reason for his absence. Teachers spontaneously proposed them instead, and his support was seen as integral as to the, quote, flood tide of lady applicants to Medchair during the 1920s. Furthermore, the first meeting at which women were presented at were in his department. In Edinburgh, there were not women employed in pathology, illustrating teachers' importance to their employment both within and out with his department. This slide shows another important point, which teachers approach to the subject of pathology, with the daily and routine work of the wards being a priority. He gathered round him a staff of about 8, half of whom were part-timers who did clinical work in the wards, and pathology the other half. This emphasises the role of the mixed pathology posts. This contrasted with the department at the Western Infirmary under Professor Sir Robert Muir, which was predominantly research orientated, meaning that potentially the career orientated males preferred to be under the professor at the Western, leaving a void at the GRI. However, it's important to note that 7 of the males employed by teacher did go on to become professors. Unfortunately, the closest any of the women got to either the Western Infirmary or pathology, being a professor of pathology, was by marrying a professor of pathology at the Western Infirmary. The mixed posts were predominantly in surgery. This meant that when the female surgeons were not progressing in the male hierarchical specialty, they could do these shared posts. One of the future female surgeons even worked in the department for 10 years. Thus, teachers argued here was integral to the entry of women into pathology, further emphasised by the fact that after his sudden death in 1930, there was not another woman employed for nearly 15 years. This slide shows a comment on Alice Marshall. Think of all the people Alice Marshall tutored, who went on to become professors, but she herself never got any recognition. On teacher's sudden death, there was a void as interim head of department, and Marshall got the position. However, in department photographs from the time, including this one from 1931, she still didn't get to sit in the position of the boss in the middle. And after they appointed a new professor of pathology, she went back to being assistant, only getting a promotion in 1935 to lecturer at the GRI. Her role in the department can be hypothesised by some comments in her book, including "I dispensed tea which was made in our laboratory," and her obituary saying she provided coffee each morning and presided over the ritual of afternoon tea and biscuits. This illustrates the perceived role of women later in the department, with lack of internal promotion. This slide shows a little of what the 20 early women did after their posts in the GRI pathology department, taken predominantly from the medical directories. This is based on what they did the majority of the time, as many of them changed jobs rather a lot over their careers. 4 became pathologists, but more interestingly, for this time, 4 became surgeons. Fewer of these women entered general practice and public health compared to other studies of early medical women. Therefore, although important points like the war and professor-teacher contributed to women entering pathology, we must not forget these were highly motivated women, with some even being determined and competitive enough to enter surgery, and many of these other specialties were not typical of women at the time. This slide shows a little of what the 4 of the 20 women who became surgeons specifically went on to do. 2, Eleanor and Helen Wingate, became the first female consultant general surgeons in the west of Scotland, although Wingate later specialised in urology. However, they were both officially consultants at the peripheral hospitals, while both continuing to operate on both genders at the GRI, although they were never officially consultants here. Urology as a specialty was relatively new at the time, which may have been a factor in Wingate choosing this career, as women advanced more easily in the newer specialties. Another of the 4, Tina Gray, who interestingly had been a nurse before entering medical school, became an assistant general surgeon at the GRI. Arguably the most successful of the 4 is Catherine McPhail, seen here in a Serbian commemorative postage stamp after setting up 2 orthopaedic hospitals in the then Yugoslavia. However, 5 out of 18 of the men became surgeons, with all of them becoming either professors or chiefs of staff. In fact, one of the men worked in the pathology department for 23 years before then becoming professor of surgery at the GRI, showing that this was an accepted pathway into surgery. This composite photograph of the physicians and surgeons of the hospital from the mid-19th century, but made in 1920, shows a mass of men, with one woman hardly visible but highlighted in the red circle. This is one of the female surgeons, Eleanor, who, although not being a consultant at the GRI, was clearly accepted enough to be featured at this time. However, this slide illustrates that fortunately this photograph was not representative of the whole of the GRI, as there was a woman who was even head of a department. Catherine Chapman was a radiologist and the first female head of department at the GRI, taking on the role after the world-famous John McIntyre left. And what's even better is that she beat a man to the role in 1920. She herself is a fascinating character, but she's quite difficult to find information on. She graduated with what was called the triple qualification in 1903. This was a qualification given by the 3 colleges or faculties at the time. In 1906, she began work as what was called a medical electrician or radiologist at the GRI. She didn't become head of department until 1920, but it appears from the minute books at the time, she tried to revolutionise the practice of radiology, as seen in the quotes here. So Dr. Chapman complained that unnecessary work was created for her department by the rule that all small accidents seen at the gate were sent as a routine for X-ray examination, which in many cases seemed to be unnecessary. Dr. Hunter suggested that there should be a closer correlation between physician and X-ray worker, and that to this end, the various X-ray assistants should be attached to definite units. Dr. Chapman thought this would be almost impossible to arrange, but suggested that short notes of the history should be furnished by the wards in each case. Now, 100 years later, it's up for debate whether this has actually even been revolutionised. However, this slide shows what I think is the more interesting part of Catherine Chapman's story, and that's her role in the suffragette movement. She lived with Marion Gilchrist, the first female graduate of the University of Glasgow. She then appears to have been heavily involved in the suffragette movement. She was one of a group of prominent female doctors, including Elizabeth and Louisa Garrett Anderson and Sophia Jex-Blake, to write to the BMJ about votes for women. A section of this letter is shown on screen here. The anomaly of our position is great, and it may be still further demonstrated by the fact that while as women we are debarred from exercising the elementary right of citizenship, as doctors we possess, in common with men, the legal power to sign certificates of insanity, which deprive men of their right to vote. Furthermore, she was the doctor who did the medical report on Emmeline Pankhurst when she came to Glasgow and got roughed up by the police, as depicted in the film Suffragette in 2015. Therefore, although she's not directly related to pathology, it shows that there were women prominently in other departments that have been under-recognised over the years. However, this slide goes back to the 38 doctors in the pathology cohort, 20 of whom were women. It shows that the men and the women in the pathology cohort had significantly different levels of career progression. None of the women became a professor. 7 of the 17 men who survived World War I became professors, 3 in pathology and the rest in clinical specialties. 2 further men remained in pathology, but in promoted posts. The men and the women in the group declared markedly different numbers of additional qualifications and awards in the medical directory. Additional qualifications and awards were declared by 8 of the 20 women and 14 of the 17 surviving men. Even women declaring these declared fewer than men. The difference is not explained by late awards for career success. The medical directory includes publications reported by doctors. 5 of the 20 women, but 10 of the 17 men reported at least publication. The men also reported more publications than the women. The discrepancies between women and men in further qualifications and publications may be relevant to difference in career progression. This slide shows the potential impact of marriage on the women's careers. Marriage was one of the significant reasons that there was hesitancy in allowing women to enter medicine. In this pathology cohort, 8 of the women married, 40%. 2 were lost after they married, and another was lost in Ireland, and it is possible she may have married and practised under another name, but is lost to this sample. 3 of the women, including 2 of the surgeons, married after childbearing age. The other 2 surgeons did not marry. The number is different that were found to have married in another cohort, particularly Wendy Alexander, the later Labour politician who did some of the first work on early women in medicine in Glasgow, where she found that 55% of the women married, and women were marrying an age closer to the national average. However, her cohort were predominantly pre-war, so whereas the pathology cohort may have been impacted by the loss of potential husbands in World War I. Yet, despite the lower levels of marriage, they still didn't manage to achieve as highly in their careers. This slide shows the department after teacher's death in 1930, when another woman was not appointed for 15 years. These photographs show the proportion of women falling. In the 1946 photograph, there are only 2 women, Drs. Marshall and Buchanan, who both continued as assistants in otherwise male departments, until 1944, when a woman was finally, but briefly, employed again. An additional 5 women worked in the department during the 1950s, but also served in a department that was overwhelmingly male, as seen in this 1956 photograph. All the women served as assistants. Nora Schuster from Manchester, the first female president of the Association of Clinical Pathologists, said that the assistant's salary was small and the laborious routine work was loaded onto her, brackets him. Interestingly, she, like teacher previously, mentions both women and men, but in relation to the assistants, she mentions women first. This slide shows the pathology department in 1970, with only 1 practising female pathologist, the other in the photograph being Dr. Marshall, who returned in her retirement. Seen here summarising the situation in the 1970s is a rather acerbic comment by an American female pathologist saying, "To see a distinguished woman in a high-level position in American pathology today is more rare than to observe a golden phoenix rising from the proverbial ashes. Both events are rumoured to have occurred, but the actual frequency of either appears to be extremely low." Therefore, to conclude, the GRI did indeed have vision. The GRI Pathology Department has under-recognised significance in the history of women doctors in Scotland. The concentration of women students and doctors at the GRI, the impact of World War I, and the support of professor-teacher all appear to have contributed. However, despite this significant advance in the early career stages provided by the department, it did not translate into lasting gender equality. Finally, I'd like to thank Dr. Alice Marshall, seen in the photograph here, cataloguing the collection at the Hunterian, as without her and her book, this dissertation would not have been possible. I'd also like to thank my supervisor, Professor Nicholson, Dr. Alistair Took and the staff of the Mitchell Archives, Dr. Mary Watson and Dr. John Shaw Dunn for their help in comprising this dissertation. Thank you very much to the Friends of the GRI for inviting me to speak today, and if anyone has any questions, please feel free to contact me either on Twitter or by my email as seen on the screen. Thank you.